Hey everyone, Dr. Rowe coming to you from SpineCare in St. Joseph, Michigan. In this video, I'm going to show you how to release, mobilize, lengthen, and strengthen your outer knee for both quick and long-lasting relief. Each one of these exercises works differently. To get the best results, go through them all and use what gives you the most relief. With that being said, let's get started. With this exercise, we're going to focus on releasing soft tissue tightness and adhesions that may have formed on the outside of the knee, causing a lot of pain. I do this exercise all the time. Let's start lying on our side with the painful side's knee towards the ceiling. Have your legs together, knees bent roughly at 90 degrees, have everything relaxed. So what we're going to do first is find what is called the iliotibial or IT band, which runs on the outside of our thigh towards our knee. When this band of soft tissue becomes inflamed, it can cause a ton of pain, leading to what is known as IT band syndrome. So what I'm going to do, and you're going to have to excuse my hairy legs for this one, it's just how I was built, is start off by taking my fingers and just kind of rolling on the outside of my knee on the outside of my thigh. I joke and call this the beef jerky band because as you roll over this area, if it's really tight, it's almost going to feel like you have a strip of beef jerky right through here. So once we find the IT band, what I'd like to do at that point is take my thumb and my index finger and start right here at the top of the knee and clamp right into it. Just apply enough pressure where it's going to be a comfortable self-massage. From here, you're going to take your fingers and start to roll them downward like this, stripping into those adhesions, that tightness. But as you do this, to take it to the next level, take your heel and slowly bring it towards your butt and then release it at the same time. It just allows you to dig in there a little bit more. I like to go over one spot roughly about 5 to 10 times. Release it, see how it feels. If it feels pretty good, I just move up a little bit and then repeat this the whole length, going from the outside of the knee all the way up towards the hip. If you do find one certain spot, like right here for me, that just is a pocket of tightness or pain, at that point you want to stop over that spot and just keep repeating this over and over again until it finally releases or you're not getting any more improvement. And if you do have one spot that is pretty stubborn and that doesn't want to release, at that point I like to take the meaty portion of my palm and just really dig into that area, attacking that soft tissue at different angles. So going up and down with it, side to side, circular motions, anything that I feel is helping out a little bit more. The great part about this exercise, not only will it help get rid of a lot of pain, but it will also help improve pain-free range of motion of your knee. With this exercise, we're going to focus on a self-mobilization or reset to open up the knee joint and get a lot of pain relief. For this one, we just need an ordinary lacrosse ball. These are really inexpensive. You can find them at any local sporting goods department. If you would like to get one online, I will leave a link in this video's comment section and description for a cheap pair. So the first thing that we need to do is find our placement of the lacrosse ball. Take two fingers and start to trace on the outside of your calf and work upward towards the outside of your knee. You're going to find a big bony mound right here a little bit off to your side. This right here is a bone called the fibula, and this is where we want to be at. So let's take our lacrosse ball, place it right behind it, and then roll towards the back side of our knee. So it should be right behind the fibula on the outside of our knee. What we're going to do next is treat our knee like a nutcracker. So just grab right in front of your shin and slide your heel towards your butt until that ball is like a big wedge on the back side of your knee. You're going to start to feel a lot of tension being built into your knee joint, and if it's locked up, you may find that you get a sudden pop or release, especially if that fibula was out of place. But what you want to do is just build up a ton of tension to the point where it feels like a deep, comfortable stretch, especially like a traction into your knee. You're going to hold this and now take your foot and just curl your toes upward towards your body. This will intensify that stretch to the point, again, where you might get that sudden pop. But just hold this comfortably for about 3 to 5 seconds, release it, and then repeat this 10 times. With each repetition, just try to build into it a little bit more. Afterwards, see how you feel. If it feels like it's helping out, but it needs a little bit more, just keep throwing repetitions in until everything is nice and released, or you're not getting any more improvement. But to take this one to the next level, what we can do is add in a little bit of a thrust thrust with our hands. So let's build back into that original stretch and just pull our heel a little bit more towards our butt. And I don't know if you heard it over the microphone. I got a really good pop into my knee with that one. But just a little bit of a thrust, not to the point where it's causing any discomfort, and you can do that a couple times to just open up and traction the knee joint a little bit more. So now let's focus on some quick relief stretches that will help lengthen tight muscles and tendons, a major cause of outer knee pain. So whatever side that you're having pain, let's say it's your left side, take the other side's foot and cross over just like this. Have your feet and toes pointed straight ahead. The first thing that we're going to do is take the hand on the non-painful side, place it right on our hip. Now drive your hips over towards that painful side as much as you can until you feel a good stretch forming on the outside of your hip working towards your thigh. Once you feel this, you're going to hold it and now deepen this stretch by slowly rotating towards the other side, moving through your waist, through your lower back. At this point, it's going to deepen this stretch, but you should really feel it in your glutes or your buttocks. Once you feel that, you're going to hold this position and then put your hands right out in front of you and reach towards the floor. So again, what we want to do is turn and then reach downward towards the floor. This stretch now is going to work from your thigh towards the outer part of your knee. Once you feel a deep but comfortable stretch in your knee, you now want to hold this for 20 to 30 seconds and then release it. On the next repetition, try to build into it just a little bit more for 3 to 5 repetitions. Another stretch that you can do is very similar. So again, whatever side that you're having outer knee pain, let's say it's your left side, take the foot on the other side, cross over just like this, toes pointed straight ahead. Let's press our hips towards that painful side as much as we can until we feel that initial stretch into the thigh. We're going to hold this and now take the hand and arm on the painful side and place it overhead just like this. So we should almost look like a ballerina. So you want to press your hips towards the painful side while your upper body, your shoulders, leans towards the non-painful side at the same time. You're going to feel a deep, intense stretch form on the outside of your thigh working towards your knee. Once you feel that, hold this for 20 to 30 seconds, release it, and then repeat this 3 to 5 times. But go through both of these stretches. You're probably going to find that one just helps out a little bit more. And at that point, I would keep repeating it over and over again until everything is nice and loose or you're not getting any more improvement. And for good measure, I would switch to the other side and repeat just to help keep everything in balance. So now let's focus on getting long-lasting outer knee pain relief by strengthening the muscles that help support this area. This first exercise we're going to do lying on our side with the painful side facing towards the ceiling. What I'm going to do first is support my head with my hand just like this and then bend my knees roughly at 90 degrees and have them slightly out in front of you. You want your legs in line with each other and then you're just going to straighten this painful side's knee out as much as you can. What I'm going to do next is turn my foot inward as much as I can until I feel a really good activation around the outer part of my knee working upward towards my hip. I'm going to hold this and now raise my foot upward towards the ceiling as much as I can until I feel a deep activation around the front of my hip. This will target a muscle called the tensor fasciae latae, or TFL, which bridges together with the glutes to form the iliotibial band, the IT band. And if you've ever had IT band syndrome, you know that this is a main instigator of outer knee pain. So once you feel a deep activation pretty much from your outer knee all the way towards your hip, especially the front part of the hip, you want to hold this comfortably for about 5 seconds and then slowly lower your leg back down and then take a breather. On the next repetition, try to build into it just a little bit more for 10 repetitions. If this movement right here feels like it's a little bit too easy, to take this one to the next level, you can do a kicking motion. So just raise up as far as you can and then kick your foot forward. You're going to feel a deep activation into that TFL. Again, hold that for about 5 seconds. But afterwards, if it feels like you have a little bit more energy, challenge yourself by throwing in another set or 2. So to target the glutes a little bit more, we can do a similar movement. So let's straighten that leg out, turn our foot inward, raise our heel upward towards the ceiling as much as we can, but this time around we're going to kick backward as much as we can until we feel a deep activation into the buttocks, the glutes. Hold this for 5 seconds, come back, release it, take a breather. Do this 10 times, but again, if it feels like you have a little bit more energy, challenge yourself by throwing in another set or 2. And for good measure, I would switch sides and throw a couple repetitions in on the non-painful side just to help keep everything in balance. Here's another really good strengthening exercise that can also help improve balance and build a lot of stability in the knee. I call this one knee glides and taps, and if it's the first time doing this, I do recommend doing it next to a wall or at least having something close by that you can grab onto for support in case you lose your balance. So for the first movement, we're going to do what are called knee glides, and this one we just need something that is going to glide or slide on the floor. I'm going to be using a furniture mover, but you can use something like a piece of cardboard, a paper plate. If you have hardwood floors, just use a sock. That should work. It just has to take the friction out of this movement. So whatever side that you're having outer knee pain, let's say it's your left side, what you're going to do is start off by placing all of your body weight onto that side's foot and place it a little bit more towards the middle part of the foot onto your heel. What you want to do next is make sure that your knee is in line with your foot. So during this exercise, make sure that it doesn't track outward or inward like this, just in a nice straight line. You're then going to just squat downward like this, taking your butt towards the floor, bending your knee at the same time. So what you want to do is just squat down a couple inches to the point where you feel a really good activation into your buttocks, the glutes, working down the thigh until you feel it on the outer part of your knee. Once you feel it on the outer part of your knee, you're going to hold that position and then place the other foot over whatever you're going to be using and put it straight out in front of you. I always tell everybody, treat this position like 12 o'clock noon on a clock. So we're going to go straight out like this, and then what I'm going to do is start to work towards 1 o'clock, 3 o'clock, 4 o'clock, 6 o'clock, and then I'm going to come back to noon. So it's like a big, nice arc. When you do this, you're going to feel a lot of soft tissue, including the muscles and tendons on the outer part of the knee, pretty much across the whole knee, start to fire. I like to build into this just over and over again for about 5 repetitions in one direction, and then I switch it up in the opposite direction and then repeat. From there, take a breather. If it feels like you have a little bit more energy, challenge yourself by throwing in another set or 2. The nice thing about this exercise though, as you do it, you're going to find that one certain position or movement really targets that outer knee a little bit more. So for me, it's coming back up like this towards noon. So at that point, I treat it like my weak link, and I just keep building into that over and over again until it feels like I got a really good workout. So to take this one to the next level and focus a little bit more on strengthening these muscles, we can do what are called knee taps. So for this one, again, whatever side that you're having outer knee pain, let's say it's our left side, what we want to do is just place our other foot out in front of us like this, have it at 12 o'clock noon, and what I'm going to do is raise my foot about an inch or 2 off the floor, and now I'm going to squat down like this, bending that painful knee so my foot will tap the floor. I just let it tap, I come back up like this. So I'm really focusing on trying to move through my knee and squat as much as I can, activating those muscles across the glutes, thighs, and knee. Do this about 5 times, relax, take a breather. On the next repetition, go a little bit more towards 1 o'clock and then repeat, and then towards 3 o'clock, all the way towards 6 o'clock if you're able to. When you do this, you're going to find one certain position that just really targets that soft tissue around the outer part of the knee. At that point, I would try to throw in about 5 to 10 repetitions. Relax, take a breather, and then throw in a couple more sets. Just remember though, whatever you do on one side, always do on the other side to keep everything in balance. If the exercises help, please support the channel by giving this video a like and maybe subscribing too. If you have any comments or questions, please leave them below. I'll get back to you as soon as I can. Thanks for watching.